So this place in particular is really important to Indigenous people within the region of Fort McMurray, Nistawio. So that's what we call Fort McMurray in Cree, and that means the meeting of three rivers.
For generations before us, this river has provided a food source for a lot of our families, and we still do have families who will travel up and down this river to Fort Chip on the boat. So this river is very important to our community, and especially the meeting place for different Indigenous communities where they would come together and spend time on the land.
So Aunties Within Reach is a multi-service program. It's community-led and supported by a team of aunties, birth workers, and midwives in the regional municipality of Wood Buffalo.
Aunties Within Reach was created out of a need to fill the gaps between Western and traditional ways of being and knowing and wellness. Traditionally, an auntie is somebody you call up that you need advice or you need a kick to get you motivated and get you going, and somebody really that can guide you along life in a good way. So we really wanted to create that for our community where a lot of our families aren't healthy and a lot of us don't have that natural support. So we wanted to create that and build that sense of community within our communities.
Traditionally, people would have to come into Fort McMurray to access healthcare for the most part. So we changed that by going out to them wherever they are to provide them really high quality, patient-centered prenatal support. And that goes on past pregnancy. So we'll accompany families at the birth, and then we will visit them back in their home community as soon as they're able to go back to provide postpartum care and lactation support and infant feeding support.
My name is Shelby Wise. I belong to Sturgeon Lake Cree Nation. You know, it was my first time having a child, so I didn't know what to expect. So they were really able to support me through that. And then also provide traditional aspects, like Sheena was providing me teas throughout my pregnancy and checking in, you know, providing smudge and really holding space for me during the pregnancy time.
And our communities do need that, you know, that there is a service for these ladies to come to if they need help or advice. And I'm in the background supporting these ladies while they go out there and do the work.
When you're giving birth in the hospital and having a C-section, you're not necessarily the first person to hold your baby. So Maddie had the role of speaking Cree to my baby and talking to the other nurses and telling them that that's the plan, that that's something I really wanted. Even though, you know, I would have loved to give birth at home, I was still held by culture and care from Sheena and Maddie throughout my whole time.
As we know, health is not just about clinical care and the access to health services. It's about cultural support and social support. So a big role of the aunties is assessing what cultural and social support is needed for those families.
We know what we need, we know what our community needs, and I think it's so important that people see people like us, we're working with people like us.
I just want to carry on, I guess, our tradition as women, as First Nations people, Indigenous people, because certain things we weren't told they were sacred. So knowing that having your moon time is very sacred, I want to keep that going with other ladies. And that to me is very important. And that's the message we try to give to our young people that come with us to the moon ceremonies, that you have to take care of your body. You know, if we could just like taking care of Mother Earth, we have to take care, because he's the one that gives us all our food or whatever we need. But as women, we are givers of life as well, and we have to take good care of our bodies to have healthy babies and healthy minds. So that I really appreciate them. We're doing this kind of work.
The program is generating some important insights around how we continue to support and uplift a local Indigenous health workforce. This is a program that is delivered by a community-based team on the ground, and it has helped us to better understand constraints on capacity, what resources and supports they need to continue to do the good work that they are doing.
We've really created a really good model of care, and we want to share that. that. You know, having been gifted these teachings and taught these teachings from our elders and our families, it's a way for us to share that knowledge with them as well and to reintegrate it into their family.
Especially with new babies, we want them to be born into knowing that there is this community, and when I say community, I mean plants and animals and aunties and elders and just this beautiful circle of people who are there to love on them and hold space for them. And having those natural supports and being welcomed into a loving ceremony is the most beautiful way that babies can start life. And so to me, that's the most beautiful thing.